Good morning, ladies and gentlemen of the dental world. Welcome to fourth episode of denTok, the first ever YouTube dental talk show, and I am your host, Dr. Amanish Singh. Today is 31st May 2020. India has reported 1,82,000 COVID cases. We stand ninth in the tally of the world with 5,000 plus deaths. Yet India prepares for its unlock 1. The most important world news today is that America has snapped ties with World Health Organization. As promised, we will talk about HEPA filters today and the high volume evacuators used in the dental offices. But before that, ladies and gentlemen, we will talk about a story in a dental office. The story which all the dental surgeons very well know, but I think we need to know it even better than before. The story begins like this. The pneumatic handpieces and the ultrasonic scalers which we use in the dental offices create droplets of water. If the droplets are bigger than 5 microns, they are heavier and have a short range of motion. But if the droplets are less than 5 microns, they are known as aerosols. They are lighter and they travel a longer distance. These droplets, both large and small, are known as particulate matter. These droplets also contain viruses, bacteria, and many other matter. The size of the smallest virus, that is rhinovirus, is 0.03 micron. The one of an influenza virus is 0.1 micron and a coronavirus is 0.12 microns. All these small particles are almost 1/100th of a human hair. So they are like very small. The water droplets, which are bigger than 10 microns in size, are stopped by the hair in the nose and the cilia, a natural filter of the upper respiratory tract. Whereas the aerosols, which are smaller than 5 micron in size, they are not stopped by the upper respiratory tract and they have a free access and travel to the lower respiratory tract right up to the alveoli. We need to understand one thing, that all these viruses do not have a mechanism to transport themselves on their own. So they get submerged in the particles of mucus or liquid, and these mucus droplets act as the vehicles for them to travel from one place to the other. The water droplet or an aerosol is like a bun which contains resins in it in form of many bacteria and viruses. So any filter which needs to stop these viruses, be it an N95 mask or a HEPA filter in a room purifier, the pore size need not be 0.03 to 0.12 microns, because it's never an isolated virus which will come their way. It's always a droplet containing these viruses ranging from the size 1 to 5 microns. So this also explains and takes away the dilemma from the minds of so many viewers, that how an N95 mask with a pore size of 0.3 micron can actually filter or stop a coronavirus which is just 0.12 micron. Coming back to the most popular word for the dental surgeons since COVID-19, the HEPA filters. What we have been hearing every day is that we must install the HEPA filters. But actually, this is a misnomer. We don't install a HEPA filter, but install a room purifier, of which HEPA filter is one of the components. Air filter sucks in the air from the room atmosphere almost 1000 cubic millimeter in 1 hour. Passes it through the series of different filters, of which HEPA is one of the parts. This air is then finally sanitized with UV rays or even with ionizing radiations. The clean air thrown out from the exhaust end depends on the term CADR, which means clean air delivery rate, which is approximately 350 to 400 CADR. So the big question now is, what is a HEPA? These are a part of high quality filtration devices used in food industry, pharmacies, computer assembly units, hospitals, and now will be used in dental offices also. The closest what we can see as a HEPA filter being used in our houses is the kitchen chimneys. So HEPA stands for high efficiency particulate air or high efficiency particle absorbing. HEPA filter is made up of hundreds of interlaced compressed borosilicate glass microfibers or plastic by the name of polypropylene with 5% acrylic adhesive. To create a fibrous mesh which looks something like this is converted into sheets, and these sheets are then folded into pleats to increase the surface area of filtration. These pleated sheets are further packed in and outside by the aluminium which directs the flow of the air into the filter. The HEPA filter is always placed after the pre-filter and before the charcoal filters. Pre-filter. A nylon normal filter like a membrane filter and can stop the bigger particles getting into the HEPA filter. Gentlemen, the common assumption is that HEPA filter is like a routine membrane filter and it will filter only the particles which are bigger than the pore size, like a fish in the net. But it is not at all true. The HEPA filters are designed on the principle of MPPS, that is most penetrating particle size, which is 0.3 micron. So it actually targets the particles which are much smaller and much bigger than 0.3 microns. The filtration actually takes place on various principles of physics. For example, diffusion and Brownian movement and whatnot. But I think for a dental surgeon, we don't need to go into those details. All we need to know is that filters up to 0.3 micron size of the water droplets or the aerosols and gives out 99.97 purified air. Ultimate outcome is that any viruses, any bacteria which is in a droplet is stopped by this filter and does not let it go to the other end. After the HEPA filter, air goes to the charcoal filters which are highly adsorbent in nature. So any air which has some foul smell, volatile organic compounds are adsorbed in there and it lets go a fresh air from there on. The air which has no particulate matter left in it is passed either through a UV light or through an ionizing radiation. Now, some companies, they suggest that the UV light should be placed at the beginning of the airflow because that's where they can kill all the viruses and bacteria. But some companies are still coming up with the UV light at the end of the filtration process so that the air coming out is devoid of all the microorganisms. The HEPA filters range from a cost of around 7,000 rupees to 35,000 rupees. You might wonder why is it so? Smaller the motor, lesser the price. Bigger the motor, more is the price. Which means that a smaller motor will suck in less air and throw out less air. A heavier motor is going to suck in more air and going to throw out more air. Now, one of the most important thing for your machine which you're going to buy, you have to find out what is the noise level, because these machines are surprisingly manufactured for a use 24/7, 365 days in a year, which means it's the sound of this machine is going to be there perpetually all the time. For your reference, the sound of your routine refrigerator is around 40 decibels and the noise generated by your ultrasonic scaler is 50 to 55 decibel sound. So you guys would be interested to know how much electricity it's going to consume. If it's running 24/7, it consumes around 550 kilowatt energy in a year, which sums out to be around 1,200 rupees per month. One of our viewers, Dr. Virinder Brar, has sent us a query. His first query was that how would you maintain it? So the companies suggest that the HEPA filters should be replaced every 6 months to 1 year, and HEPA filters are actually not washable. But of lately you are coming across with more companies who say that yes, it is still possible to wash them in cold water. So dear all, the best way to clean a HEPA filter to be economical is dampen a cloth with water, squeeze out the excess water, use it on the filter nicely, don't let it get wet, and dry it completely for 2 to 3 hours before you reinstall it back. Because the moisture in the HEPA filter, which does not go away easily from the mesh, can actually encourage the growth of the mold, actually defying the purpose of the air filtration altogether. But vacuum cleaning of this filter would be the best thing to do every 15 to 20 days, because the residue is attached there. You must remember that the major residue will be taken away by the pre-filter, which is made out of nylon, and it's absolutely washable. So I hope the principle of HEPA filters is very well understood now. You can install it closer to your chair, you get anywhere in the room, and automatically the air suction is going to go on. So if you ask me, I think it is personally recommended in this time that we must install the HEPA filters depending upon the room size, depending upon what is the requirement, and so on and so forth. Now, a HEPA filter is picking up air from anywhere. But what if you had a HEPA filter which could go very close to your chair, and the moment the aerosol is being generated, it captures the same? It's a good idea. Now, ladies and gentlemen, HVE is nothing but that. Yes, it is true that HVE contains the same mechanism which has been explained for an air purifier, but for an extension of an arm which goes very close up to 20 centimeters of the patient, and the moment the aerosol is generated, it can actually take up and suck in the aerosolized air and can pass it through the series of filters, giving the fresh air at the end of it. So if you ask me which is better today, I would say every HVE is a HEPA filter, but every HEPA filter is not an HVE. Principle is the same, the motors are almost the same. The air suction power is approximately 100 cubic meters per minute, which is approximately the same as in the HEPA filters. Air is sucked in right from the source. It goes through the same pre-filter which filters the moisture from the rest of the air. The air is then passed through the HEPA filter, the charcoal or the activated carbon filter, finally going up to ultraviolet rays and even an ionizing radiations, that is ozone. So finally the outcome of an HVE and HEPA filter is the same, except for the air collection method, which stops 90% of the aerosol going on to the dental surgeon. As far as the cost of an HVE is concerned, just post COVID-19, some of the companies sold it for 70,000 to 80,000 rupees. But now, as the days are passing by, the world is unlocking, probably the prices are also coming down. And we have come across a couple of machines which are just 47 to 48,000 rupees in the cost. Now, I hope I have been able to make the concepts of a HEPA filter and an HVE very clear to your minds, and it is the need of the hour which will make you decide whether you need it or not. But if you ask me personally, I feel that having an HVE is more important right now. However, you can have one HVE and one HEPA filter at the same time for the bigger offices, thereby removing the fear of the aerosol together from your minds. I'm extremely thankful to the viewers, and we have come out with 4 episodes and we have had our share of viewership, which has been phenomenal and very, very encouraging. So I request you all, ladies and gentlemen of the dental fraternity, share it and do subscribe the channel, because if you subscribe it, it encourages us to do even better work. We'll come up with more informative and storyline based videos, which will be definitely good for dentistry and the profession as such. As we unlock down, we must remember that COVID is still around. The dental surgeons still are the same vulnerability level. We must ensure that we have all the PPEs, the administrative and other protocols are followed. We have to keep working and helping the society relieve the dental pain. So ladies and gentlemen, thank you so much for being with me today. Keep safe, God bless you all, and cheers to dentistry.